Hello and welcome to the channel on andrology and men's health. So this is the third part of the video on treatment of impotence. The first was oral medications, and when the oral medications don't work in moderate cases and where the erectile dysfunction is to a greater side, then the next step comes intrapenile injections, which I had explained, which we injected into the penis. And now, when that is not effective, the last step and the final step in the treatment of erectile dysfunction or impotence is the penile prosthesis. So, what is a prosthesis? Prosthesis is a device designed to replace a dysfunctional part of the body or to repair an impaired part of the body. In case of the penis, there are these two tubes, and this is the penis, single penis. It has two tubes in the inside. That is the corpora cavernosa. These two tubes. There is increased blood flow during erection, and then there are muscles which relax and they retain blood in this penis to maintain erection. So when there is a pathogenic cause, or there is a cause which is causing erectile dysfunction because of decreased blood flow or because of the inability to retain blood, then these tubes do not fill and one cannot achieve an adequate erection for intercourse, so rigid erection for intercourse. So in that case, instead of these dysfunctional tubes, these tubes have to be replaced by a prosthesis. So that will be the penile prosthesis. So this is the two tubes. So these tubes are replaced by this prosthesis. The prosthesis can then act like these prostheses are rigid, and therefore they act like a rigid tube. That means, and if they make these tubes rigid, and because these tubes remain rigid due to this prosthesis, there is an erection which can achieve intercourse. I will explain each one ahead differently. Which is the basic concept of a penile prosthesis is to replace the dysfunctional tubes with a rigid silicone or not metal but silicone or any substance with good resistance. There are different types which I will explain ahead. Prosthesis, there are two tubes have to be kept, one in each corpus, which is the corpora cavernosa, which is there inside the penis, one in each corpus, two tubes per prosthesis. There are different types of prosthesis. There is the hinged prosthesis. That will be hinged prosthesis means the sharp penile prosthesis is the one which I have here. This is the sharp penile prosthesis. It is hinged, that it bends and becomes erect, and then again it can bend upward and downward. So this is the hinged prosthesis, sharp penile prosthesis. There can be malleable prosthesis. So this is the malleable prosthesis. As we see, it is very rigid. And it can be malleable, meaning it can be bent. So it can be bent to 90 degrees and it retains that shape, and then it can be bent back to make it straight. So it is a lot more rigid than the sharp prosthesis, but it was bending in both directions because it is more rigid. So this is another type of malleable prosthesis. Now this is when it is completely erect, it can be bent, it stays in that shape, and then it can be straightened back. So there are many bent and then again straightened back. So there are many different types of these prostheses which I will discuss in further video. Different companies and different types are there. So the malleable prosthesis, as I showed, they have to be bent, and once they are bent, they have to be straightened. So they have a memory. So they don't have a memory. Sorry, this one has a memory, sharp prosthesis, whereas the malleable one, which I showed, does not have memory and it has to be bent, and it gives good rigidity, but at the same time it is less natural because it remains bent when it is bent, and it has to be made straight. So during intercourse, if it bends a little, it will remain bent and it has to be straight. So it is less natural, but it gives very great rigidity, the malleable one, whereas this sharp inner prosthesis, it looks more natural, as in it springs back into position once it is concealed in the underwear. Once removed, it's springs back into position and gives a more natural feel compared to the malleable one. Both do give good results. And the third one is the inflatable penile prosthesis. So now this is the inflatable penile prosthesis. As you can see, now this is in the deflated state. It has three parts. This is the two tubes which are made of polyurethane, and now there is a pump and there is a reservoir. So when we press the pump, the fluid from the reservoir goes into these two polyurethane tubes and makes the penis rigid. Now as you can see, it is rigid, but the tips are conical and soft, so protecting the glands. So now it has become rigid. It becomes more rigid than this, but this is a specimen which has been removed, so still we can see it is becoming rigid. And now there is a valve. When we press that button, Again the fluid flows back from the tubes and when we tubes into the reservoir, and it has to be, the penis has to be just pressed so that the fluid, it gets deflated and the fluid goes back into the reservoir. So this is how this is the reservoir which I'm holding now, and that is where the fluid is, and then we pump it up. The fluid from the reservoir fills the two cylinders, and the cylinders are made of polyurethane. They become erect. As we can see, only slight bending is there, and they give a good rigidity and quite a natural feel. And then there is a single release valve, so that when we press the valve, one we can feel this valve which there is in the scrotum, and it's superficial, so one can feel in the scrotum, activate it, pump it, and when you want to deactivate, press the valve so that the fluid flows out. So that was the inflatable, and this is the image. The two cylinders are in the two tubes, and the pump is in the scrotum, and the reservoir is in the just in the lower part of the abdomen. So one wants to make the penis erect, one has to press the valve, it becomes erect. After intercourse, it can be deflated by activating a well situated valve in the scrotum. Out of these three, inflatable gives the most natural erection, but it is by far the most expensive. It costs up to 7 to 8 lakh for the implant, and I will discuss the cost in a separate video. But these are the three types of prosthesis. The cheapest being the sharp penile prosthesis, the in between being the malleable prosthesis, which comes in 4 different companies, and it can be the Boston Scientific, it can be the Rigicon, it can be the Promedon, or it can be the Zephyr. So these are the 4 different companies which make this malleable prosthesis. And then there is the inflatable prosthesis, again made by Rigicon and by the AMS Boston American Medical Systems, the Boston Scientific. So that is the most expensive one. So out of these processes, which is the best process for a patient? That depends on the individual patient, it depends on the age of the patient, it depends on his expectations, his partner's expectations, what is the cause of the ED, whether there is any fibrosis, whether there is any mild degree of curvature, or whether there is any other abnormality. So which process is better, or depends on these factors, or even if the previous surgery has been done, again the choice for the processes can differ, and the most important among these is the patient expectation, and again another most important is the patient preference and budget, because the cost is varied for each prosthesis. So these are the factors which come into play while selecting which prosthesis is better for a particular person. Important to note is that any prosthesis used will not have an erection which is as good as a natural erection, which can be attained even by a tablet if one achieves a full erection, or a full erection with an injection will always give higher satisfaction rates compared to the implant. So if anyone is responding to the previous two medications, then the implant should not be considered. When they are not responding to those two, then the implant becomes a good treatment choice, because since they do not have a good enough erection for achieving satisfactory intercourse and to satisfy their partner, the implant will definitely benefit and change their sexual life, especially if it is in younger males, some of them who have failed previous marriages because they had an intrinsic problem with their erection. So this implant for them is a boon, and it changes their sexual life and their overall life. Hence we proceed in a stepwise manner from the oral tablets to intrapenile injections, and then to prosthesis. For males without any erection or very poor erection with previous treatment, processes is a very good option and it gives good results. What happens with the penile prosthesis to the penis, in the sense what effects it has on the penis, what are the things which the patient might think it might be affected, what can be affected, what is not affected, or how is the penile length, and everything will be discussed in my next video in FAQs, that is FAQs of penile implants. That will be in my next videos. I'll cover the intricacies and what doubts generally are there in people's mind will be covered in that. And thank you for listening to this talk. Kindly like and subscribe. Also, if you have any queries, they are welcome in the comment box, and further details can be viewed on the website mentioned in the link, or can be communicated via the email ID mentioned in the description. And thank you. Like and subscribe. So that concludes the video. In subsequent videos, I will be discussing each prosthesis in detail. That is the sharp prosthesis, its pros and cons, the malleable prosthesis, the different types, its pros and cons, and the inflatable prosthesis, different types, different companies, pros and cons, and which one could be suitable for you, for the patient particularly. Thank you.